Hi, everyone.
Hello.
Welcome. So everyone who's joined in, feel free to use the chat to share anything or introduce yourself while we wait. I think we have about 20 participants registered. So we'll give it a few more minutes so everyone can join in. Great. So as people are joining in, I'm wondering if people could put in the chat like where they're joining us from, just so we have an idea of where the participants are or where you're located. Oh wow, we have Colorado. Great. From San Antonio, Houston. Great. Yeah, if you just joined us, we're sharing in the chat where we're joining from, so we have an idea of the where people are located. Okay. Welcome, Candy. Welcome, everyone. We'll maybe give it maybe 2 more minutes for people to join in, and then we'll go ahead and get started. Yeah, and feel free to use a chat to ask any questions. We'll we'll try to respond to your questions as best we can, or connect with you after the webinar with either more information or just to follow up with you. Great. So everyone who just joined in, we're sharing in the chat where we're joining from. So just let us know where you're connecting from. Great. Well, we'll go ahead and get started. Welcome, everyone. I'm Dr. Sandra Vanegas, and with us we have Dr. Sandy Magaña, and we have a couple of our graduate students, Mariana Davila, Christopher Lee, and Angelica Hernandez, who are also supporting us on this webinar. And we're hoping to really provide some information as well as some resources for families who may have some concerns about mental health, either for their children with disabilities or themselves or other caregivers. So before we start with the presentation, just a little bit about us. So I'm an assistant professor in the School of Social Work at Texas State University. I'm a bilingual developmental psychologist, and my research focuses on understanding and improving the development of diverse children with autism spectrum disorders and other disabilities. And presenting with me is Dr. Sandy Magaña, and I don't know if she wants to introduce herself, or should I introduce you?
Yeah, I can go ahead. So I'm a professor at the Steve Hicks School of Social Work at UT Austin, and my research is focused on the cultural context of families that care for children with developmental disabilities, but also more recently identifying disparities in services and diagnosis for autism and developing interventions to address those.
Okay, great. So just to give you an idea of what we'll be talking about today, we'll start very briefly just highlighting why mental health is important, and then we'll go over some signs of depression and anxiety in children with disabilities, as well as the same signs and what that might look like for caregivers of children with disabilities. And then we'll conclude with talking about some tips and strategies that you can use at home to support mental health concerns that you might have. And then we'll highlight some projects that we have that are that may be a benefit to you and your family. So great. So we'll get started with why is mental health important? It may seem very intuitive that mental health, all health is important, right? But mental health is particularly important because it can really affect and have an impact on your physical health and your well-being. For example, we know that when you're feeling stressed and you're feeling overwhelmed with things, your heart rate might increase, your blood pressure might increase. You may have gone to the doctor and been told like your blood pressure is high, so maybe just relax. Try to not get too stressed out about things. We also know that when you're stressed out this week, it tends to weaken your immune system, and this makes you a little bit more vulnerable to getting a cold, getting the flu, or even getting infections. And generally, we know that even stress and mental health, if it's affected, it's going to affect your quality of life. So you may be focused more on those issues versus enjoying your life with your child, with your family. So it's really important to take care of your mental health in the same way that you would take care of your physical health. So we'll move on into and talking about some of the signs of depression and anxiety in children with disabilities. So why is this important? So we know that children with disabilities, they have the same experiences as children without disabilities. However, the way that they may present and even talk about their experience may be different than children without disabilities. And we know from some research that a significant number of children with disabilities experience symptoms of depression and or anxiety. So about 35.4%. So that's about 1 in 3 children has some experience with some experience and symptoms of depression or anxiety. So this means that we really need to be mindful and watchful for those symptoms so that we can best support them. When we think about depression, these are the diagnostic criteria for depression. It's really that mood, that depressed sense of mood. But we also see some difference, some other changes in your typical in their typical routine. For example, change in eating habits. So they may go from eating regularly their regular meal to losing their appetite, or eating more than they would typically eat. We also see that change in sleeping habits. So they may have slept 8 hours a day, but then they may go and stop, they have trouble sleeping, or they want to sleep a lot more than typical. We know that children may also exhibit restlessness, so that they seem anxious in a way because they have all this movement but without a purpose. But then we also may see this loss of energy where they just don't want to get up and do the things that they typically would like to do. They may also have feelings of guilt or worthlessness, difficulty concentrating, and they may be having recurrent thoughts about death or suicide. This may be aligned with even the type of play that they're engaged in. And if the child exhibits 5 or more of these, this is a concern. This would indicate a clinical level of depression that would really require professional help from a mental health professional. So what might this look like for children with disabilities? So we know that those are the general symptoms of depression, but we know that with children with disabilities, it might look a little bit different. So this is based on some research that has actually looked at what do children who have depression, what do they actually demonstrate, or what are some of the behaviors that we see in them and that can really distinguish them from children who don't have depression. We know that there's this general increase in sadness. They may be more tearful and be very apathetic, where they seem like they don't really care about what's going on. They may have more disruptions in their sleep. But they also may exhibit other behaviors, such as being aggressive towards others or being hyperactive. And then for some children, we may see that they start losing some of the skills that they had gained in terms of self-care. So they may have gone from being able to dress themselves to not being able to do that anymore, or not wanting to do that anymore. And then we know that they may interpret their feelings, their emotional feelings in a more physical way. So they may complain that their body hurts, or they may have different pain. And then this may then affect how they're performing in school. So all of these are in comparison to what you would typically see in your child, and seeing a change in how they would typically present. So these are important things to think about in terms of depression, that it goes beyond just feeling sad, but it may look a little bit different if you're for a child with a disability. In terms of anxiety, these are the clinical symptoms of anxiety. It's that, we may feel, or we may talk about it a lot in terms of how we feel anxious, that we don't know, that we're worried, that we are scared, that we have a lot of fear about something. But then there are also some other symptoms such as feeling restless, you may feel tired, difficulty concentrating, and all of this may, you may also exhibit, or they may feel irritable. There's that muscle tensions where you feel it in your body, and then your sleep can also be disrupted. And for children, just having 2 or more of these would indicate a clinical level of anxiety. And these would also require referrals to a mental health professional. But then with anxiety disorder, we see a broad range of ways that anxiety can manifest, especially in children. So we have separation anxiety disorder, and this is where there's a fear of being lost or separated from the caregiver. And that goes beyond what is typical or what we would see typically in young children. There's selective mutism, so children stop speaking in situations where it's called for, and we know that they have the ability to speak verbally. They may have specific fears about something. So, for example, fears about spiders or fear about snakes. And then there's some other ones, other types of anxiety disorders, including social anxiety disorder. That's being fear of negative evaluation by others. Panic disorder, which is a fear of having a panic attack, and then generalized anxiety disorder, which is so the criteria we reviewed. And this is about worrying about general everyday things. So it's not tied to something specifically. And then when we think about anxiety in children with disabilities, we know that oftentimes it can be related to their performance at school. So they may be anxious about turning in their homework, completing a test, even social activities or social relationships that they form in the school, or even in sports. However, with children with disabilities, sometimes the behavior may be a little bit harder to interpret. So for one example would be if your child is refusing school, there are a lot of different things that could be happening. So for example, they may be exhibiting separation anxiety where they don't want to leave mom or dad or their other caregiver, so they don't want to go to school because they fear that separation. But it could also be tied to anxiety related to being at school. Maybe the sensory environment is too overwhelming for them, so they don't want to go to school. So sometimes it's hard to interpret why a child may be exhibiting certain behavior. And we know that with some children with disabilities, sometimes communication may be a little bit limited, or they may not have the right words to describe what they're feeling or what scares them, right? Or why they're worried. And then with anxiety, we also see a higher rates of externalizing behaviors. These are things like you would consider like acting out or being aggressive. So if your child is acting out, it may not be that they're being aggressive intentionally, but that's a way that they're manifesting that anxiety that they're feeling about something. And then we do see that children with disabilities tend to have higher rates of separation anxiety disorder, and that's compared to children without disabilities. So that may be something that is a concern, that may be maybe a reason why your child may demonstrate certain behaviors. So it is definitely something to keep an eye out for. So great. So now we'll move on to talking about some signs of depression and anxiety in caregivers of children with disabilities. And I'll pass it over to Dr. Sandy Magaña.
Great, ready to go. So you all as those of you that are parents of children or caregivers of children with a disability, you know many of the stressors that that you're experiencing. These are just some of them, right? Navigating services, coordinating responsibilities for your child, financial stressors. And I would say a big one is challenging behaviors. I mean, that's one of the research shows that's one of the main stressors that many parents face. And of course, right now during this period of COVID and social distancing, all of these things are being exacerbated. So if you're feeling stressed right now, you're not alone, you know, and it's completely understandable. you know, trying to navigate what services are available through online, whether, you know, whether you have access to Wi-Fi. I mean, those are stressors. Financial stressors, we've heard from families are heightened because of loss of job or other kinds of things during this period. So this is a time when you might be experiencing many of these stressors. Next. So caregivers of children with disabilities, just think about yourself. Usually they don't, as a caregiver, you know, you're not taking the free time to relax. You're just so caught up in taking care of your family, right? You're not really finding things that you like to do because you're trying to figure out, you know, things that your family can do. You're not, especially in this time of social distancing, going out with friends and loved ones. Maybe you weren't doing that very much before, and now that's even exacerbated. And I know a lot of parents of children with disabilities feel selfish if you do these things for yourself, which you have to rethink that, right? You know, I think it's important. Well, you know, thinking about the airplane example, you've probably heard that before, where the flight attendant says that in case of emergency, put your mask on yourself first and then on your child or others. So just think about that. You've probably heard that before, but just think about how does that apply to you, and why would that be recommended in your case, in the situation of caring for your family and your child with a disability. So I think that's an important thing to think about. And next slide. So I'm just going to give you a few seconds just to think about what are you currently doing to take care of yourself on a regular basis. Just take a few seconds to think about what you're currently doing. Sometimes it just takes us reflecting on these things because you know you're supposed to be doing X, Y, and Z, but then if you're not really allowing yourself the time to think about it, a lot of times it gets overlooked and skipped. Next slide. So we know that from the research that family members of children with disabilities experience clinical levels of depression, anxiety at a fairly high rate, maybe 31% of parents, usually moms, right? Because most of the research has been done with moms, and they're the ones that are usually the primary caregiver. And so that, you know, if you have experienced anxiety or depression, it's important to know that you're not alone. A lot of other people are experiencing or have experienced that. And it's not you, it's a normal experience in the context of all of the different stressors that you have. So yeah, and yeah. So thinking about depression in caregivers in adults, I mean, it's similar to depressive symptoms in children, although, you know, slightly different. You might be able to recognize these more in yourself, and it's a little bit harder to recognize sometimes in children. But just think about in the last, you know, week or two, have you had any changes in your eating habits, changes in your sleeping habits? Have you had restlessness, feeling like your body's moving without purpose, or just feeling a loss of energy? Or have you been feeling guilty or worthless more often than not? I mean, a lot of us have those feelings from time to time, but, you know, is this something happening more often? Are you having difficulty concentrating or making decisions? And of course, a big one, recurrent thoughts about death or suicide. That's a very important one. If you experience 5 or more of these, it's important that you do see a health professional. And I would definitely say for the last one, you should absolutely, even if you're not experiencing the others. But, you know, think about health professionals in terms of your regular practitioner, if you have one, and we'll explore a little bit more about what healthcare professionals you might be able to see. Next slide. So related signs for depression in adults might be feeling tearful all the time or more often than usual. Rumination, so thinking over and over again about something that you did that you just keep, your mind doesn't let you stop thinking about it, or even just worrying about things excessively, or even pain, because a lot of times depression can manifest itself through your body. And so how you're experiencing your body could make a difference. Next. And so anxiety is another issue that many adults and caregivers experience. And so that could include excessive uncontrollable anxiety and worry. Again, just, you know, worrying about things that maybe you didn't worry so much about in the past, feeling edgy or restless. A lot of things will get us in that point where we're feeling edgy or fatigued, difficulty concentrating, irritability, muscle tension, disrupted sleep. You know, many of us are experiencing some of these, maybe one here, one there, but when you're experiencing 4 or more of these at one time, it's important to see a healthcare professional. Next. And there are physical signs to anxiety, like shortness of breath, your heart rate increasing, feeling dizzy, excessive sweating, your heart is racing. And so these are physical symptoms that, you know, could be manifest because of a physical condition, but they can also be manifest because of increased anxiety or depression. Next. So I'm going to turn it back over to Sandra so we can talk. We talked about, you know, sort of the symptoms and problems, but let's talk about what we could do about it.
Yeah, so great. So there are a lot of things that you can do to support yourself and your child if you're experiencing any of these symptoms. However, as we mentioned before, if you or your child have 4 symptoms, if it's anxiety, or 5 symptoms, if it's depression, then it's really important to see a healthcare professional. So depending on your health insurance and what resources you may have available, you can first start by seeing your primary care physician, and they can either you know, really figure out, you know, is it a medical condition that's contributing to some of these symptoms, or, you know, is it really important to do a more in-depth referral to a mental health professional? There's county mental health agencies that can also be very supportive and providing services. And then there are also government-funded healthcare clinics that can provide services on a sliding scale, or services that are more accessible for families with low resources. So we do have a few contact information for more local ones, and since we're based in Austin, there will be more related to Austin. But there are these types of agencies in many other states and cities as well. And that would be if you experience more severe symptoms or more of those symptoms. You have a lot more than just like 1 or 2. Or if it's more consistent, it's like almost every day, all day, every day for weeks at a time. But what we wanted to focus on was talking about some strategies you can do in the present with your child and yourself to sort of manage some of it in case it isn't as severe or isn't as prominent. And hopefully these strategies will be helpful. And so, yeah, so one of the first things that that you can do is having a 10-point check-in. So oftentimes when we are feeling anxiety, we tend to look at the more severe things, thinking about the worst outcomes. And so it's maybe helpful to do some sort of like grounding. So this check-in is really focused on, you know, bringing you back to the present, to the here and the now. So it's focused on a lot of the sensory aspects. So you just start with taking 10 deep breaths, and then you name 9 things that you see. Then you name 8 people who support you, name 7 colors, name 6 things that make you happy. and so forth. If you feel that that might be too long, you could even just start at 5. So taking 5 deep breaths, name 4 things you hear, name 3 things you can touch. Take 2 deep breaths, and then really reflecting, okay, how do you feel now? And doing this in a very slow process. So not rushing through it, because that kind of takes away the whole point of really being grounded into the present. And these are things or exercises you can even do together with your child to sort of help practice bringing each other back to the present. And then some other tips on managing stress. So these are just 5 or 6 things that you can do to think about how, we know that especially during this time, there's a lot of stressors. So sometimes it's not just about just taking a deep breath, but really thinking about what can you do around you to really address all the things that are stressing you out or causing problems for you. So one of the first things would be to look to see if there are respite services available to you. So respite services would be where someone is able to come and watch your child, care for your child for a period of time while you are able to do other things such as run errands. These individuals are typically trained to work with children with disabilities or individuals with disabilities. So you may not have to worry about, oh, are they going to be able to take care of my child? So that's a really great resource, especially if you're feeling that you can't handle going to the grocery store and having your child with you, or multiple children with you. We know that challenging behaviors in children with disabilities can often be a stressor for many parents. But there are supports out there that can help you think about strategies or implement strategies at home to address or prevent some of those challenging behaviors. Some other things that can really help the stress and control would be thinking about how can you improve your healthy lifestyle. So we know that there's all these things that are recommended, but actually trying to start little by little, right? So you may not be able to do everything at once, but maybe just take one healthy activity and start with that. And then incorporating your family into those healthy activities so that it's a family effort and not just an effort that you're maintaining on your own. It's important to avoid smoking, alcohol, and substance abuse. These things can increase the stressors that you may experience. And then we know that as caregivers, oftentimes we feel like we want to do it alone or that we have to do it alone. But just remember that you're not alone in this journey with your child. There are others. Think about who are your friends, who are the family members, who are even other providers who can be supportive during different situations. And then some other things that can help manage stress include doing mindfulness activities such as breathing exercises, yoga, or meditation. And then we have a list of some relaxing activities that you can do with your child, such as go for a walk. And we know some of these strategies, maybe you had a list of activities that you used to do with your child before COVID that worked great, but now with social distancing, it may be really challenging to do that. So hopefully these things you may be able to do. You can feel free to put in the chat if you tried any of these things, or maybe there are other things that are on here that you found have been very useful. So feel free to share. I know even sometimes just taking a minute to think about what do I do to relax, right? We need to remember to find just some balance, right? Even though it may seem that we have to work or have to do things all the time, but it's important to include these relaxing activities so that you have the energy, so that you load up your battery, right? So that you can continue supporting your child and supporting your family. And then some other things. So we know sometimes when we feel anxious or we're feeling depressed, sometimes it's we ruminate on a problem. We think about, oh my God, I have this big thing. I have no idea how to fix it. And it may feel very overwhelming, and you may feel paralyzed by the worry, by the magnitude of this problem, right? But sometimes that may prevent you from really thinking about how do you actually solve this problem, or how do you approach this problem in a more productive way. So just thinking about the traffic lights, right? We can just stop, take a moment, really think about the problem. What is it that's really the core problem? And you may even start by breaking it down into different steps or different parts so that it's easier to tackle each part on its own. Remember to take a few breaths, really think about it, and really minimize the worry about the magnitude of the problem, but really think about in smaller parts. Once you sort of stopped, then you can kind of slow down, think about, well, how do I make a plan? How do I tackle each of these parts? What can you do or say to work towards solving the problem? And then you can move forward with your plan. You can even think about maybe having a backup plan in terms of thinking of alternative options of how to address this problem. So hopefully that will make this big problem into, breaking it down to smaller things that are much more manageable and much less stressful. And then finally, it's important to think about creating sort of like a coping toolbox. So this can either be a physical box that you actually put things that make you happy, or put a smile on your face, or help you feel a sense of calm. Or it can even just be a list, just a reminder for you, or even for your child, of things that are helpful to really cope with any challenges, any stressors, or any problems that come your way. So thinking about what are some things that help you relax or remain calm. Maybe you have like a stress ball that you can squeeze, and that kind of helps you get a better sense or cope with whatever challenges come your way. You can think about what are some things that help you when you have a lot on your mind. Maybe coloring in a coloring book helps you really slow down your mind and really think about what it is that you have to resolve, or what situations are present. And then thinking about what are some things that help you solve your problems, right? Maybe you have a good friend who's a good person to bounce ideas off of. So maybe writing their name down on the list of, this is my coping toolbox. These are the things that are going to help me in situations when I feel overwhelmed or I have a problem that I don't know how to solve. So by doing this in a time when you do feel calm and there isn't an emergent problem or an urgent situation, might be helpful, because you have the time and to really think about it and really reflect on things that have helped you in the past and things that you think might help you in the future. So great. So we do have some resources. These are just some general information that may be available to you, or that different places that offer mental health resources, primarily in the Austin area. Many of them will also offer services in English and Spanish, as well as different ranges of financial resources. We'll be posting these in the chat box in case you want to save any of this information. There's also some national resources for mental health. And they have a lot of great videos, as well as fact sheets and information in terms of on how to identify different mental health concerns you might have, or even a lot of great strategies on things that you can do at home as well. And then there's also connections to finding treatments or finding services in your local areas. And then we know that there's also a need for resources for children with disabilities. These are some of the different organizations in Texas that can connect you or help connect you with different supports and resources for specific to disabilities. Once again, these are Texas specific. But if you, for example, if you look up disability rights organizations, as well as the ARC, there's often specific organizations in more local areas or different states that can help also be supportive to families. And then finally, I wanted to highlight some programs that we have available for families. One is the Aspen program, and this is a parent-mediated intervention program where we provide information as well as training to families who have a young child between 18 months and 6 years of age, who either has autism or who's at risk for autism. This program is 12 sessions. There's a lot of great resources that we provide to families. If you have a young child, or if you know someone who has a young child who may have developmental delays, or may have autism or autism symptoms, feel free to reach out to us. You can reach out to me. I've included my email and phone number. Families can also be referred through, or you can self-refer through this link here, and you just include your information. We'll reach out to you with more information about the project and see if you're eligible. And then another program that I'll let Dr. Magaña talk a little bit about is the PODER project.
Yeah, the PODER project, we're focusing on children from 6 to 17 years old, so a different age group, and we're really focusing on the health behaviors and trying to promote good health and prevent overweight status among children with developmental disabilities, because we know that children with developmental disabilities do have higher rates of obesity compared to children who don't. And so that's an important area that we want to focus on. And then we know that the caregivers, as we talked about before, don't necessarily take care of their own physical health and diet and nutrition either. So we want to understand first what is going on with families. And then secondly, we plan to develop an intervention for this. And so we're looking for children between 6 and 17 that have either autism, intellectual disability, or Down syndrome, and their caregivers. So we do have a few questions for the kiddos, but we're asking a lot of questions for the families and some surveys. We're doing telephone surveys. There are 3 different telephone surveys, and so each one, the parent receives $25. And we give you some specific tips on promoting your health in terms of your own nutrition intake and physical activity intake. We also give the kiddos a little toy for their participation. So if you want to find out more about this, there's my email, or you can go directly to this link and put your information and we'll get back to you. And I believe that information is in the chat box as well.
So we did finish a little bit early, but that just means that there's more time for questions. So feel free to, you can either unmute yourself or put questions in the chat box. We'll stay around for a while. I've also included all our contact information, our email addresses, as well as some of our social media pages where you can find out more about the program, or stay tuned. As part of the Aspen program, we are doing tips of the week. So if you want to just learn simple tips that you can do at home with your child to promote their development or to foster that your relationship with your child, feel free to follow our Facebook page. I've included the link there. And then just stay tuned. We'll probably be putting out more information that will be helpful for families of children with disabilities. So, so thank you for joining us, and feel free to ask questions. Okay, so there's a question about, is Aspen only for referrals or suspect autism? It is not only for referrals. If you have any concerns about your child's development, you can contact us. We do have a screening that we do, and as long as the child meets the criteria on the screening, then they would be eligible. And we can provide more information to families once we have their contact information. We can give you a call and talk a little bit more about the criteria. So yeah, other questions, other concerns? You can also feel free to share any resources that you found helpful as well. I know we are always learning from parents and caregivers of children with disabilities, so.
I'm curious if anybody wants to volunteer information. Like, what are some activities that you do to help your own well-being? If anybody wants to throw that in chat, or there's a resource there. Good.
Well, I can speak for myself. Usually I take a walk in the middle of the day, or if I'm doing homework or schoolwork and I feel very overwhelmed, I'll just take a walk with my dog, take him out for a few minutes, and then I'll come back. I feel very, very refreshed after that, even if it's just for like 10 minutes.
No, that's a great, just stepping out for a walk. I mean, there's no charge to that. You don't have to pay a gym membership. You can just go out for a walk for sure.
Yeah, it's surprising how helpful just getting fresh air feels, right? Because even now we're mostly at home, or we may be, feeling stuck at home, where, with the four walls, and but just going outside and just breathing that fresh air, getting that sunlight can be energizing.
And the weather's so nice right now. And I also wanted to say that there is recent research about yoga, and there's a lot of places you can access yoga online now. We know with the pandemic, where you could do yoga from home, but there is a connection between parents who have children with developmental disabilities who do yoga and kind of reduced problem behaviors. It's kind of a surprising finding, but that research is being conducted and found right now, where it has a lot to do with the fact that if you're stressed and your child is picking that up, I mean, they pick it up, right? Without you saying anything to them, they pick it up, and it manifests in their behavior, and vice versa, right? There's sort of a cyclical pattern between your child maybe having some behaviors because of their own anxiety, and then you picking that up and experiencing that yourself. So there is this sort of cycle, and sometimes just doing things to reduce stress in yourself really make a big difference in terms of the child and your ability to deal with your child more. I mean, we all know the word patience, right? Everybody here, I'm sure, is very familiar with that word, but it does help you to be a little more patient, step back, stop for a minute, think through things if you're relaxed yourself.
Yeah, and I know on YouTube there's now, I think, a lot more videos on doing yoga, and even doing like child yoga. So there's like child-friendly yoga positions. So it could be a great family activity in terms of both doing yoga to support your health, your physical and emotional health. So, are there other things people have done or people like to do?
One thing I like to do is create like a game plan. Hi, I'm like Christopher. I'm one of the grad students. So one of the things that I even looked this up, there's a research backing it up. It's called PST, but I forgot what it stands for. But pretty much you break it down to goal setting, brainstorming, you evaluate your solutions that you came up with. You pick one and then you implement it. Sometimes even though it sounds so simple, when you break it down like that, when you're feeling overwhelmed and there's so many things going on at once, it helps you keep track of like, okay, I've done this, time to move on to this next step. And so because one issue with anxiety is sometimes you may feel overwhelmed And this helps you give direction. Instead of focusing on 5 different things at once, you're able to break it down like, okay, I am doing this because this action will lead to this conclusion, and this will help me feel more secure or has pushed me along through the day. So that's something that I like to do too, is just write out everything and then make a plan for it.
Yeah, it's a great tip. And we know that even many children with disabilities really benefit from having like a visual reminder, right, of what to expect, or even like what are the steps for today, or what are the things for today. So this can even be like a family activity where you do plan out the steps, or how, what are you going to do together in the day, and doing it in a visual format can really alleviate some of the anxiety the child may be feeling if they don't know what's in store for today, especially now that there's been so many disruptions in children's routines with school, and even just being at home all the time, right? So yeah, so what are are there any other questions for us? Any other
Tips or ideas?
yeah.
So one thing that I do is I like to cook. Specifically, I love to bake. Whenever times do get stressful and I need to take a break, I really enjoy baking. It kind of gets my mind to take off, take away from things and to really focus on just what I'm doing at the present, and then just take a step back. So I enjoy cooking. I know that's something that my aunt has done. She has a daughter who is autistic, and that's something that they ended up trying to bond in, is cooking together. Maybe she gets the eggs or pass her the milk, and it's something that they can both do together. And just now they're doing this. They're starting like a little business now, and cooking, or at least baking. So that's just a tip that I recommend.
That's great. Great tip. All right. Well, I don't know if there's anything else, any other questions or concerns. We will be making this recording available. We'll be posting it on our social media sites as well as our website. So if you wanted to go back and maybe look to see at some of the strategies or some of the tips, or maybe even some of the symptoms that you're not sure about, you should be able to connect through one of our social media platforms and find the video, and just fast forward to the part where you wanted to review. But stay tuned. We will be posting or hosting more webinars for families in the coming months. So if you do have any suggestions for topics that you would like to hear more about, feel free to put that in the chat, and we'll try to get more webinars, more information out to families, especially during this time.
And there's a question about where they can learn about future webinars.
Okay, great. So we've been posting information about our webinars on our Facebook pages. So that would probably be the best place to keep track of any future webinars. I'm not sure how people heard about this webinar today. We'll try to reach out to the same community organizations to share the information about future webinars. But if you really want to just get it from the source, you can follow us on our Facebook pages. If you follow Facebook, and I believe we'll also try to, try to post it on Instagram as well. And our Instagram is the same as our Twitter handle for Aspen. So yeah, or you can also just reach out to one of us via email, and we can keep you updated, or add you to a list so that you hear about our future webinars.
Mm-hmm.
Great. Well, we hope that you found this helpful, or you learned something new, and hopefully we can share more information with you all, and we can hear about you more from you all, and then in the future.
All right. Bye, everybody. Have a good day.
Yeah. All right.